Thank you everybody for attending. This is our Medisoft EDI webinar. Finally, the EDI solution you've been looking for. I'll start by introducing myself and my co-host, Natasha Brown. My name is Kevin Clough. I'm the general manager here at AZCOMP. I've been able to be here in this company for a little over 20 years now. And so really since the beginning. And I actually started back in 1998 doing technical support for Medisoft here when Medisoft was a smaller company based out of Arizona. And back then it was version 3 of Medisoft. I don't know if any of you have been on Medisoft since version 3, back when it was a DOS-based program, but I've been doing this a long time with Medisoft. I know that I see some familiar names on the webinar today. I've talked to many of you over the years, and thank you for being here again and for your trust in us. On the other side of the screen, we have our talented and extremely knowledgeable Natasha Brown. Many of you have worked with her over the years, I know. Natasha has been with our company a little over 12 years, I believe, and she is seriously, and I'm not exaggerating when I say this, one of the top experts in the entire nation when it comes to all things Medisoft EDI. She spent the last 12 years training and implementing customers on the entire process of sending claims through Medisoft. In addition to that, whenever we have our most challenging problems, whenever the clearinghouse can't seem to fix a problem or diagnose a problem, or our tech support team, Natasha is the one that gets those hard issues and questions and complicated problems. And she has a real knack for being able to properly troubleshoot those, diagnose them, and get those resolved. So she's really good, and I think you'll see that later in this webinar as you get to hear from her. Okay, let me just start also by giving you just an overview of what we're hoping to do and accomplish today. So really, the purpose of this webinar is to help you be more successful by letting you know what Medisoft EDI can do to help in your world. Well, we've been in business for a long time, as noted just a few moments ago. I've been here a little over 20 years, and in those 20 years, I've worked with, I think it's safe to say, thousands of our clients. We speak to customers regularly that are doing things the hard way or don't currently have the tools in their tool set to be able to do things the right way, or the way that will save them time and help them. In other words, some of you, I believe, are really struggling through the revenue cycle process. Let me give you a real life example here. Just 3 or 4 weeks ago, I was having a conversation with one of our customers, one of our clients based out of Utah, just a single doc office. And he was kind of lamenting the fact that it's so hard to stay afloat today for smaller healthcare businesses. He was talking about how he's being squeezed on all sides. He's being regulated to death, right? His staff needs raises. His patients can't or won't pay. Insurances are giving him a hard time, and on and on and on. During the course of the conversation, it came out that at some point in the conversation, I remember him saying that he was talking about his staff wanting to check eligibility for patients and then going to each individual payer website to check eligibility. And that immediately kind of perked my ears up. He also talked about how difficult it was for them to follow up on claims, and how they didn't really know how to do that or what to do, and how they were spending so much time trying to apply payments and adjustments to the patient's account. So obviously all those things really caught my attention, and and that's just a really good illustration of what I mean when I say that many of you are struggling or don't have the tools or don't know how to find the tools to be able to help with some of these problems. So I was able to tell him, I said, hey, doctor, let us help you. Because you're not using Medisoft EDI, I can tell you with some confidence that you're probably paying too much for your clearinghouse that you're currently paying for, as well as your staff really don't have the tools to perform their function. They don't really have the ability to be successful. And so with Medisoft EDI, we can We can get eligibility to be automated so that your staff can walk in the morning and all of the eligibility is automatically already done, already checked for all of the patients that have appointments scheduled that day. And we can also eliminate most of the time it takes them to apply the payments and adjustments if they're using the ERA function correctly in revenue management. So anyway, that's just a couple of things. And to help us understand that there's really different ways, better ways we can do this. So it's our hope and intention that a few things as we go through this webinar ring through loud and clear for you today. For number one, we hope that you can see how much time in your daily work role and responsibilities that you might be able to save with some of the things we're going to show you today. We believe that we can make a significant dent in the time that it takes to do certain tasks. Some of you might be already doing some of the things that we're going to show you today, but probably not all of them. And there's probably a wide mix and variety of the way that all of you that are attending this webinar are probably doing things in Medisoft. So we hope to be able to give you back some time and help you be able to do things that are revenue generating tasks and not some of these mundane tasks that it takes to do some of this billing and reporting and so on. After we talk about that, then we'll get into we'll list out some of these tools that we're talking about, the better tools to manage your revenue cycle. And we'll list those for you. We'll then just talk a little bit about the monthly cost, how we believe we can lower your current bill. At that point, we will turn it over to Natasha. By the way, I'm going to get through those first three items really quick. We're just going to cover them from kind of a high level, just to give you a taste. And then Natasha's going to go into the program. She's got a lot of cool things to show you and to work through that I know you're excited to see. We're excited to show you. And then lastly, we'll follow this up with the Q&A, be able to answer some of the questions you might have. So let me just cover this saving time and what we mean by that. So first of all, we believe that the amount of time that we can give you back is significant. We're going to help you get back in control of your time and your ability to manage the revenue cycle. So let me back up for just a moment and give you just a brief background. As you know, in the past, for those of you that have been using Medisoft a long time, you know this. Medisoft has the ability to send really to any clearinghouse in the nation. Well, that's both good and bad. Good because you have a choice of clearinghouse, but bad because the developers of Medisoft really couldn't fully integrate. They really couldn't sink their teeth into just one solution, right? That allows them to really wrap the EDI solution into Medisoft and make it a real asset and a tool for your Medisoft and the way that you do your billing. So a couple of years ago, nearly, I think it's 2.5 years ago now, the parent company of Medisoft, which at that time was called EMDs, was acquired by a company called CGM, or CompuGroup Medical. So they're now the parent company of Medisoft. And they have also, for a long time, they, as part of their solution set, had a long time proven mature clearinghouse that most of you are familiar with. So of course, this clearinghouse and Medisoft are now part of the same parent company, which again, of course, gives the developers a chance to really build this solution into Medisoft and tightly integrate it. And that's what we're here talking about today. It's called Medisoft EDI, right? And there's really some powerful tools, and this integration that we're talking about is powerful. Will save you time. It makes it a complete solution baked right into your Medisoft program. And our view here at AZCOMP, is just a little side note, our view is we're really excited for this. We've been consulting on Medisoft for a long time. We recognize that there was some gaps in that process and some tools that you needed. And so we're really excited about it. We're really excited that you guys can see this today and that we can share it with you. So let me give you a little taste of what I'm referring to. So with Medisoft EDI on the left-hand side of the screen, claims are sent directly from Medisoft. Okay, and so what that means is that there's no more logging into a different website, no more navigating to the part where you upload the claim and go ahead and upload the claim file to the clearinghouse at that point. I know a lot of you are doing it that way, and that's what we mean by this integration. Now in Medisoft, you just click a button, click send, and it automatically just sends it right to the clearinghouse. After the claims are sent, those reports are automatically downloaded right back into your Medisoft. Every time you go to the reporting section, those any reports that are available for you at that time, ERAs, acknowledgement reports, so on and so forth, those are all directly into your Medisoft. So again, there's no opening a browser, navigating to a certain website, signing in with the username and password, navigating to a certain area of your clearinghouse's website where you can then download reports, and then you have to go import those into Medisoft. You don't have to do that anymore. It's right into Medisoft. So we hope that saves time and makes it more efficiently. Now, here's a big one for eligibility. It is, and I know I mentioned this just a few moments ago in my my story about the client in Utah, but eligibility is automatically verified for all scheduled appointments. You have the ability to do those one at a time as well, as needed in several different places in the program, but you can also set it up so that all scheduled appointments are automatically verified the night before. And so when you walk in the morning, when you walk in the office in the morning, all the appointments that are scheduled have eligibility ran, and it's notated and updated in their appointment in Medisoft. So no more going to individual websites to check eligibility for and taking all that time and steps to do that. The ERA files, those are automatically read into Medisoft. Those payments and adjustments are automatically applied with the click of a button. I know a lot of you on this webinar may already be using this feature, no matter what clearinghouse you have. However, there's some enhancements with the integration with Medisoft EDI, and those payments and adjustments are auto applied. So if there's anyone here on this webinar that is manually keying in payments and adjustments from your EOBs or ERAs, we need to get that need to get to working smarter and not harder. So the claim, one other thing here, the claim status is updated in Medisoft. For example, to reject it. So if you send a batch of claims and a couple of them get rejected for missing information, now in your claim management window in Medisoft, the status will be updated to rejected. So right now what happens is anytime you send claims, if some of them are rejected, they all still show a status of sent rather than rejected. So it'll be updated in Medisoft so that you can quickly filter or see which ones were rejected right from within your Medisoft. And there's more. I just wanted to give you a taste of some of the things that we're talking about. Okay, let's move on here to the better tools. I told you I would list some of those things. We're hoping that it's going to take you from clearing snow with a snow shovel to having an industrial sized tractor to help you do things a lot quicker and in greater magnitude. Apologize to anyone who this triggers. I know it's been a rough winter for some of the people in the Western United States, California, Utah, Colorado, places like that. I know have been slammed, but we're hoping this illustrates kind of what we're doing now to what we hope to get you to. So I wanted to list a few of those industrial tools that we're going to get you with Medisoft EDI. Talked about eligibility already. I won't spend a lot of time on that, but huge tool for everybody. There is a denial management tool called Revenue Resolve. This is big. We have a lot of people that are adopting this. We have more people that are asking about it. I know it's a big thing in the world, but Revenue Resolve really takes away the complexity of determining which claims were denied. Those claims are automatically reviewed for the claim adjustment reason code, as well as the remittance advice remark codes, and they're assigned to each claim. And so Revenue Resolve really simplifies the process of identifying those, and then they're assigned into a Revenue Resolve bucket where those claims can be prioritized based off of the reason for denials. They can be tracked and assigned to different staff members according to your workflow. And then there's also some reports you can run to show your top denials. And so you can see your problem payers, your denial statuses, and that'll really make it easier for you to improve your process and reduce future denials. So great tool there. Real-time claim status inquiry. That is something that that you can do in Medisoft now, as well as through the portal on the website. Natasha will show you that. You can be able, if you're wondering what's going on with the claim, why they haven't paid, what's taking them so long, whatever the case may be, you can do a real-time claim status inquiry that pings the individual payer, and they will send back a response telling you what's going on, what status it's in, and give you more information. Patient responsibility estimator is a big thing these days as well, right? You want to be able to set your patient's expectations up front and what their responsibility will be for the financial responsibility for that visit. You'll be able to see how that works a little bit, and again more. Lastly here, the last thing before I turn it over to Natasha to show you some of these things is we 9 times out of 10, so not every time, but the great majority of time, we can lower your monthly EDI costs. In fact, we tend to get so confident about it that we offer to pay people $100 if we can't. So if you don't think we can beat your current EDI rates, and give us a call, and if we can't, we'll send you a check for $100. No strings attached. But we're pretty confident that we can, and we really do it because we have different pricing plans, and so we really just look at each individual situation. And what I mean by that is the number of billing providers, the amount of the monthly claims, the number of claims I should say that are sent, and then we can fit you with the appropriate option that's just going to save you money. So some of you might have a high claim volume with few billing providers. Others may have many billing providers but relatively few claims, as like for instance with a mental health business. But whatever the situation, we can look at it, determine which category you fall into, and then put you on a billing plan that's going to save you money. And we do it all the time, especially if you're a billing company or an RCM company that's on this webinar today. You're really going to want to look into this because usually that's a significant amount, again, depending on the amount of claims that you send per month. And of course, lastly, besides lowering your hard cost of the monthly EDI bill, we really do believe that the real savings, the real value is in your ability to be efficient, and therefore save time, and therefore be able to work on things that are really important to your practice and revenue generating tasks. And that's probably what's more valuable than even lowering the hard cost of your monthly EDI bill. Okay, so with that, let's go ahead and show you inside. And so at this point, we'll ask Natasha to go ahead and show her screen and take you through some of these things that we've been talking about so you can get a visual. So Natasha, go ahead and take it away. And remember, everyone, that at the end of Natasha's presentation, we'll go ahead and do some question and answers. So Natasha.
All right, thank you, Kevin. And thanks so much for the kind words in the intro. All right, so I'm going to start with the eligibility automation that Kevin talked about. So because the eligibility verification is a real-time eligibility, meaning when you submit that request, it's going to shoot the information through the clearinghouse. The clearinghouse is going to shoot that to the insurance payers portal, and then they send a request back. And all that happens within 30 seconds if you're doing it manually. But there's also a way that we can set up an automated task to where it's going to automatically update your calendar. So if you are using the calendar in Medisoft, there's several different ways to use eligibility. So it's excellent service. It's going to save you tons of time. You don't have to pick up the phone and call. You don't have to go to each website and log in. That takes all day. So if you are using the calendar in Medisoft, I'll show you this way first. We set up that automated task to where it will run 2 to 3 days before the appointment. You can pick, if you want 2 or 3 days or even 4 or 5. We recommend 2 because, longer than that, anything can happen with our policy. So the 2 days will allow you to go in and check your calendar. It's going to flag your appointments on your calendar just like this to let you know which ones pass. The ones that have the flags have active coverage. The ones that have the red X have no coverage. So this is showing you the appointments 2 days ahead of time. You can go in and check that, and that way it gives your staff enough time to pick up the phone, call the patient, see if they have a new policy, or see if they plan on paying cash, or whatever arrangements need to be made or information that needs to be corrected and updated in your system. So that's the first way, is the automated task. If you want to manually verify the appointment, so let's say you don't want to set it up to where it verifies all of the appointments on your calendar, that's absolutely fine too. Or if you add an appointment that day right then and there, you can verify it yourself as well as you add your appointment. So it's totally up to you. You can right click on the appointment and then it gives you the option to verify here as well. And then also it is going to give you the response here. This is the eligibility screen. So when you do right click, this is what it looks like. It also keeps a log of every previous eligibility verification that you've done for that patient. So this will stay, it stays in the patient's, it's also viewable from the patient's case as well. So I'll show you that in just a moment. But so it keeps it here, a log, an ongoing log. So you can always go back and see when the last time it was verified. And there's several other fields in Medisoft I'll show you too, where it puts that information. So if there is only one insurance policy for that patient, it automatically runs and sends it once you open that eligibility verification screen. If there is more than one insurance, it gives you this screen that pops up so you can select which insurance you want to run. So you can do your primary first, run it, and then do it again for your secondary. But you do only have to do one insurance policy at a time, because it does send that a file for that specific insurance. So that's the reason for that. And again, when you do it manually with this step, it takes less than 30 seconds. Once it's done running, you're going to get the status. It'll say completed at the top, and it'll also show whether the verification is active or inactive. And then you'll just click the view eligibility button to view the results from that eligibility. And this is what it looks like here. So it's going to give you in all of these areas, you can shrink these and you can maximize and minimize this area here where it says deductibles and active coverage. So it does give you the annual deductible amount for individual and family, and then it also gives you the remaining amount. And since it is a real-time eligibility, that's what's in the insurance company system at that very moment. So you are getting the real-time amount. There's no delay in that. It's what's in their system when you get this response back. It also breaks it out by specialists, in-network, out-of-network. It gives you the copay amounts. It also gives you the co-insurance amounts. You can see here at the bottom. So it's very detailed. As far as the information that comes back, it does vary by policy, of course, because some policies may not have a co-insurance at all. So sometimes they won't even send that info back. And some of these responses are very, very detailed, longer than others. You can see some of the policies give you the number of chiro visits and more detailed information. We can also set it up in your appointment calendar to a certain specialty code. So if you are a chiropractor or surgical visits, we put that specialty code in there and it gives those amounts based on that specialty code. So we can customize that too. These are the new fields that now display eligibility in the newer version of Medisoft in version 27. On the bottom left, on the left-hand side, this is the appointment view where it now is going to display. This is the copay, the top box there with the copay that says $45. That's the copay that somebody manually typed in the old school way in Medisoft. If you're, pulling it from the insurance company portal, or you're calling them and then you're typing in what the copay amount is. The bottom of the screen, this is what updates from the eligibility request automatically. So you no longer have to manually type that in the patient's account. And it also tells you the last time eligibility was checked on the appointment. Every time you pull up a patient's appointment, if they've ever had eligibility check, it will tell you the last date that that was ran. So that's important information to know, so that when the patient comes and checks in, or 2 days before their appointment, you can see that, oh, they haven't had verification in a while. Let me make sure they still have this policy before the appointment happens. And on the right-hand side of the screen here, this is inside of the patient's case. There's a new field here in the newer versions of Medisoft that also updates that eligibility information in the case. So if you're not using the calendar in Medisoft, you can still have that information populate in the patient's case as well. And here we also have, along with the eligibility service, another little bonus here for using the integrated eligibility with Medisoft is that you have a shortcut when you have a new patient that comes in the office. Instead of manually creating the chart and the case and filling all of that out, and then going back in and doing the eligibility manually, that's a lot of steps. It takes a lot of time to do that. There is a shortcut now called the New Patient Quick Add. So if you just right-click in the chart menu, it gives you this option. And there's only 7 fields that you need to complete that I've highlighted here. So it's basically just the patient's name, date of birth, the assigned provider, which you can default that in there, a description of the case, which you have to use that anyways to create the case, what insurance they have, and their policy number. So you'll notice there's no chart number at the top. This is a brand new patient. So when you click the Save button, what this is going to do is it's going to create the chart for you. It's going to create the case for you. And I know you're thinking, what about the address? We'll just hold on a few seconds and I'll show you where that will pull from. So once it's done creating the chart and the case for you, it's going to also automatically run eligibility verification. And it's going to give you this screen where you can, this is the screen I mentioned earlier, where you can minimize and maximize it. So when you click on that little arrow there, it's going to maximize it and give you all the deductible information like I showed you earlier. And then it's also going to give you this screen. This is the patient's demographics. It pulls from the eligibility verification. So on the left side of the screen, if the patient is a brand new patient, of course, you're not going to have, all I put in was the first name and the first name, last name, date of birth. The address isn't there yet in the chart that it created. But on the right-hand side of this screen, this is information that pulled from the eligibility verification to populate in the chart. So you can look at it. All the fields in yellow are new fields that's empty in Medisoft or different from what's in Medisoft. So you can select one at a time, or if you want to move it all over into the patient's chart, you'll hit the check all button at the bottom of the screen. That's going to transfer it into the patient's chart and save it. And from there, you have a chart created, you have a case created, you have eligibility verification was checked, and you didn't have to manually do the data entry for their demographics. So that is less data entry, saves time. When you save time, you have time available to work on other things, following up on claims, caring for patients, the important things. So it's definitely a valuable shortcut there. A lot of our clients really love that. It really does save a lot of time. If it's an existing patient, you can also check eligibility from within the patient's case before scheduling them. So if they're calling in for an appointment and you don't want to put that appointment on the calendar just yet, you can also go to their case, and there's an eligibility button there that gives you the same screens to verify their eligibility. If it's an existing patient that is on your appointment calendar and you just want to verify that their demographics and their eligibility, you also have in the drop-down menu, if you right-click on the appointment, the option to do a patient demographic quick query as well, where it'll do eligibility and pull their demographic information as well for an existing patient that's already on the calendar. So you've got several options there to do eligibility and patient demographics. If it is an existing chart, you'll see here I put an example on the left side of the screen where a patient has an address that's different than what came back on the demographics on the right side. Any information that is different in the existing patient chart, again, it's going to highlight it in yellow, and you can select the fields you want to update in the patient's chart by just clicking check all and then save, and it updates it for you in the chart with no data entry. All right, I'm going to now go to Medisoft and show you a few things in there, how to do the automated claim submission or automated claim submission, excuse me. Give me just one moment to move that over. Okay, so in Medisoft, for those of you who are already doing electronic claims, this is your claim preview screen here where you build your claim file in revenue management. So the automated part that's in revenue management is when you click this final send button, this is when it's going to automatically transfer these claims to the clearinghouse and to be processed. You're going to be able to go to the clearinghouse within a few minutes, and you're going to see those claims start populating in the clearinghouse portal if you want to. You don't have to go to the clearinghouse portal to view the claim status, because once you click the send button, it does a send and receive at the same time. And any EOBs, any ERAs, the electronic EOBs, any ERAs that are sitting in your clearinghouse mailbox, those are going to download along with any claims reports. Those are going to automatically download into your reports menu in your Medisoft. So this is the automated process. Now, when you have the third-party clearinghouse, you have to click send, you have to save the file gets saved, you have to browse, you have to go pull up your clearinghouse portal, log in, do all the steps to go in and manually upload that file. That takes a lot of time. It's very tedious. Sometimes people get errors. I just had somebody call me yesterday I trained them yesterday, and she was using a third-party clearinghouse and was saying how some of the files aren't making it there. And I said, well, that's because you guys have to manually upload it. If that person is not uploading them correctly, the file will not make it to that third-party clearinghouse because it's not automated. So this way that it's automated, it can be tracked. If there's any communication problems, it will give you an error letting you know that. So she lost several days of claims because whoever was uploading it just wasn't uploading it correctly, or someone created the file and someone else didn't upload it. So there's a lot of room for error there when you have to do it manually and it's not automated. So this way you are going to get a report that's going to confirm that the file made it to the clearinghouse. And inside of that report, let me show you, I'm just going to close out of those. Inside of that report, here's our report screen. So you will have this, I like to call it your clearinghouse mailbox, kind of like your email box. This is where you can always hit the Get Reports button, and anytime you hit this button, it's going to connect to the integrated clearinghouse and pull down again any reports that are sitting in your mailbox of the clearinghouse. And so here is an example. I had to do a PDF because my demo account doesn't match the claims that are on this report, so I couldn't update those, but let me show you. So this is an example. I know it's empty because it's a fake one, but just to give you an idea, you're going to get a functional acknowledgement report. This report's going to let you know, it'll say accepted, which means all of the claims in your file were accepted. Partially accepted is going to let you know that, okay, some of them were accepted and some were rejected and did not load into the clearinghouse. And this is usually due to format errors. Something was missing on the file that caused it to not be able to load correctly in the clearinghouse on one or more claims. So it'll give you that information. And this is the report that when you view this and you close this report out, it is going to update the claims here in your claim management screen to the rejected status. So you will know that those are rejected. So as soon as you close that report out, they'll get updated to rejected. And what you can do to find a list of those quickly is just hit list only and select the rejected status, hit apply, and these are the ones that were rejected on that report. So that you can go back and correct those and send them back to the clearinghouse. Now, since they're clearinghouse rejected claims, you don't have to send them as a corrected claim, putting the frequency code of 7. You don't have to do any of that. You just correct them, come back in here and double click, change the status back to ready to send, and it's going to go back out in the next batch of claims that you send out. So there's confirmation that the file was actually loaded, as opposed to the client I worked with. She did not get that confirmation and didn't know that that file was never made it over. So that is one of the huge benefits of having the integrated clearinghouse. So I also want to show you the ERAs. So that is another huge time saver. 99% of the time when I do an ERA training with someone and they get it set up and I do training for the first time, they always say, why didn't I do this sooner? Because it is such a huge time saver. As I'm sure all of you know, posting ERAs can be a huge task. It's tedious. It's a constant data entry. You can do data entry errors and accidentally apply it to the wrong date of service. So this is a huge time saver as well. When you open up this screen, the first thing is when you get a paper EOB, all of those EOBs look completely different. You have to look around and find the allowed amount, look around and find the adjusted amount. Some EOBs no longer even list the adjusted amount. You actually have to calculate. You pull out your calculator. I've seen people do it, and I've had to do it when I help someone with a paper EOB and calculate the charge amount minus the allowed amount to figure out what was adjusted off. That takes a lot of time. And again, data entry errors, human errors. So how this works with the electronic remittance advice is when this screen opens up here, all these boxes are automatically going to be checked. They're just not checked in my demo because it's a fake one again. So excuse that, but yours will all be checked. If they're not checked, that just means that the information on the remit that came back doesn't match a claim that's in your Medisoft. So how this works is it goes in, and if you see this blue box here that I've highlighted in blue, the top line is the information that comes from the insurance company. The bottom line is the information that comes back, that it pulls and matches from your Medisoft. So if this top line, this chart, and this data service and procedure code is not in your Medisoft, the bottom line will say unknown. So it matches it up exactly to that data service and to that procedure code. It's going to post it on each payment and adjustment to the charge line specifically, not just to the patient's account as a whole, but to each charge line, so that when you run reports, you will know which charges have not been paid yet. And when you also use the AR tracker, which if you're not using that, please look into that. One of the best utilities that has been added in Medisoft. That AR tracker is an integrated aging tool that will pull any of these dates of service and charges that are not paid yet. So with this, another few of the features to using this or benefits to using this is the second line here shows exactly what's in your Medisoft so that you're not having to go pull up the account, look it up, see if it's already been posted, see if it's, you don't have to do a split screen till you do your posting. It shows you here that $100 was billed out. You already collected a $15 copay. There's a legend key up here in gray, so that's how you can see what those amounts are. And we would do training with you to explain all of this in detail, how it works. I just want to point that out, that saves a lot of time too, without doing a split screen, going and pulling it up and seeing if it had already been paid or not. You also have the ability to assign notes on your patient's account. So if you had a denial and you wanted to put notes about that, this top box is for internal notes. It transfers it directly into your transaction entry screen and links it to that specific charge line. So if it's still sitting there unpaid, if there's a note on it, you'll see exactly why. Also, in the bottom half of this, you can also add notes to your statements so that you don't have to explain to the patient, if they receive a statement for $55 and they're calling in saying, why do I owe $55? You can create these custom codes. Now, these are examples. They don't come in everyone's Medisoft. You can create your own unique codes that you'd like. But this is just an example of some. So if there was a copay, you can select this copay code and hit OK, and it's going to add that to the patient's statement to let them know your insurance indicated that you owe a copay. So you have these shortcuts here to help out a lot too, to prevent phone calls from coming in from patients with questions. This helps out a great deal. You also have the ability to print a single EOB for one single patient. So if this was one where, and on this screen, it does tell you that this patient has primary. This is a Medicare EOB and their Medicare is primary. And it shows here they also have Blue Cross Blue Shield as secondary. The one up here primary and Aetna as secondary, it shows Aetna is paper. Although Aetna does accept secondary claims, this is just an example. If you had an insurance that did not accept secondary claims electronically, which by the way, you can send through our integrated clearinghouse, all of your secondary claims electronically without attaching an EOB. That's a huge time saver too. It pulls the primary payment and adjustment information from Medisoft from the patient's chart, and it includes it on that secondary claim. It's a huge time saver. It also saves you a lot of money on postage, printing out paper EOBs, printing out the claim that goes, the primary or the secondary claim that goes with those paper EOBs. Saves you a lot of time and money. And then you can't track them when they're on paper. You can track electronic claims. So that's another benefit. But anyhow, if you did have an insurance company that only accepts secondaries, like the small insurances, because all the larger ones do, but the very small insurances that don't accept secondaries electronically, you can print out that one single EOB for this claim by hitting the print details button, and that's going to generate an EOB for one single patient on this EOB. It is popping up on my other screen. Let me slide that over. So you'll see here, it just has one patient on it. So that is another benefit. And with using the ERA service here through revenue management, all of the remits, everything on this screen looks exactly the same for every single insurance. So once you get familiar with it, you're going to be able to zip around here and quickly post remits. I mean, we have clients who say, oh my gosh, I went from 5 hours to 30 minutes posting all the ERAs for that day. Significant time saver. So all you have to do once you review it, again, one of the main things we get with people that don't do electronic remits is they say they want control of, they feel like they're losing control of what does and doesn't get posted. You still have full control of what does and doesn't get posted based on these boxes here. If there's a denial and you don't want to post it, or anything that you don't want to transfer into Medisoft, you just simply uncheck the box. If the boxes are unchecked, that information is not going to be transferred in Medisoft. So you still have full control. Once you review it, everything looks good, and you want to post it, you're just going to hit the post button. There's also some filters here that are huge too. If you have a large remit, you can use this and quickly view to see if you have any denials, because you don't want to miss those. So this is a huge feature, so you don't miss any denials. It's going to show you takebacks. I have one take back here. And this is also capable of posting any takebacks, the reversals that they send back when they give you a corrected EOB. And the claims that are not crossed over, I mentioned before, if you need to do a paper EOB, if I select not crossed over, it's going to show me the patients that have a secondary where Medicare did not cross over to the secondary insurance company, the ones that you're going to have to send because they didn't send it for you. So that's significant too, so you don't miss any of those. So once you review it, everything looks good. You can hit the post button, and I'll go ahead and click on that. It does give you the option to change your posting date. So I'm going to put today's date in here because it defaults to the date of the check, but I just want to be able to find this easily on my deposit list so I can show you where it posted. And then you can select, and this information saves in your deposit list, whether it was electronic funds transfer or a paper check you received in the mail. So we'll select that and then go ahead and hit OK. And it's now posting. And we're going to get a pop-up. I already got the pop-up. It's on my other screen. So it took a few seconds. It's done posting. Once this pops up, that lets you know it's done. You will get an EOB report, a remittance summary report showing you the line items that you did select to post. So here's the confirmation that with the boxes that are checked, these are the line items that were transferred into your Medisoft, along with the summary of the report down at the bottom with your totals. It's very detailed. And some people like to use this also if they did have any denials and they chose not to post the line items. It'll reflect with the boxes unchecked here so that they know those are the claims that they need to go back and correct in Medisoft. And you can save this. You don't have to print it out. You can save it as a PDF in a folder if you need to retain those copies. So I'm going to go in and show you in your deposit list So at the very bottom here, oops, I accidentally put tomorrow's date. Oh, no, that is today's date. This is yesterday's date. Here we go. So here's where it shows in the deposit list under description ERA. That lets you know it was done electronically. And you can always view the detail that was on there by hitting the detail button as well. Here's all the detail. So it added all of this for you. That's a lot of data entry that was saved posting those. And then in the patient's account, pull one of these up. So here on the bottom half of the screen, this is everything that transferred over from that remit that I did not have to manually key in myself. And everything here is applied. So if I hit the apply button, you can see where that money was applied to that specific date of service and that specific procedure code that we looked at earlier. So it does all of that work for you. You don't have to key all these lines in, hit the apply button, type that dollar amount in, and mark it as complete. A lot of time saved. It's very accurate. So that's the ERA service. So I hope you guys are already doing that. If not, please call us. Save your time. It's valuable. A few things I want to show you on the Clearinghouse that also come with our integrated Clearinghouse, some services that you can opt in for. So first of all, I just want to show you the dashboard. You'll have access to this as well. So again, after you transmit your claims, you can always come to the dashboard and look at your summaries here. Some people prefer the automated reports that come in Medisoft. Some people like to look at a dashboard, and that's fine too. You have access to both. As soon as the claims hit here, you'll see total number of received. You can put a date range here, or you can even select today, yesterday, and it'll display that information that was received during that time frame. And if you had any that were rejected, you can, so I'm going to hit total received because I have some fake claims down here. So you see the one that's rejected here. Excuse me. It's nice because you can see on the right-hand side in the last column that the EOBs are attached to each of these claims. So if you ever need to go back and view those are directly attached to the claim. If a client calls in later on, or a patient calls you, 2-3 months down the line or whenever, and says, I need a copy of my EOB, you can quickly do a search by the patient's first and last name, come in here and find the claim, click on that $sign, and it's going to take you to the EOB that's attached to this claim. Quick and easy. If you have rejected claims, you have the capability to correct your claims within the portal as well. You can do it through Medisoft and rebuild a claim through Medisoft, or you can do it on the portal. Either way, you can correct the claim here and rebill it. You also have the capability to do attachments. So we have the attachment service as well. You can come in here and let's see, it's not switching over. Here we go. Oops. Oh, it's telling me it's down here at the bottom. So you can drag and drop your file. You can even select if the attachment is only needed for one service line or for the entire claim. You'll leave all the boxes unchecked and just drag and drop your file here. It takes 8 different kinds of file formats, PDF, TIFF, GIF, all the common formats. Drag and drop it here and hit submit attachment. And the Clearinghouse, if the insurance company accepts electronic attachments, it will send it electronically, or it'll let you put the insurance company's fax number in or phone number in, and you can, fax number or address in, and they can mail it for you or fax it for you. So that is one of the services that we offer, as well as the attachments for the claims. Huge time saver, so you don't have to print the claim out, print the attachments out, drop it in the mail, and then wonder if they ever actually received it, because you cannot track that. So that's one of the services. Another one I want to show you, and I'm going to go back to the previous screen. You'll notice there's a timely filing letter that's automatically attached to your claims. Again, time saver. When you click on that timely filing letter, it downloads. If you look at the bottom left-hand side of my screen, downloads as a PDF. The whole thing is generated for you. All you have to do is hit print. Or save it if you have, e-fax, and fax it over to your insurance company, or however you send things to your insurance companies, you have this timely filing letter. You can even save this and put it in the attachment and have the clearinghouse send it over. So you have lots of options here. All right, I want to show you the patient estimator service. So we have some real-time services that we offer. Again, and you also have the capability to do eligibility here on the portal as well. So for the eligibility, I'm gonna pull up one here. So for the eligibility, you just select what insurance payer you want, and then the boxes that are highlighted here in red are the required boxes. I don't have a real patient, so I'm not going to hit transmit, but when you hit transmit, it gives you the same information that Medisoft gave you for the eligibility verification. So this is just another option if you want to do eligibility before you even create a patient's chart in a case in your Medisoft. You can run eligibility here online, and then if they have active coverage, then go create the chart in the case and update it there. So that's an option, and you can always go back and search for those requests to at a later date. It keeps a copy of all those in here that you've done. So I want to show you the claim status. So I'm going to select the insurance payer. I have this fake one here. I'm going to put in my policy number. Give me just a second. And hit transmit. Now, when you pull up your insurance payers, it's going to, again, put a red box around all the required fields, and then you'll just fill those in and hit transmit. And this is an example of the claim status inquiry. We call it the CSI, if you ever hear CSI. Not the detective show, but claim status inquiry. And this basically what this is, it's a real-time claim status. This information is pulling from the insurance company's database, and it gives you all the real-time status of that claim for that patient. So of course you'd have to put in the date of service, but since this is a fake one, I didn't have to do that. But it gives you here the claim status category. All of the insurance companies in their system, they have their own unique category. So sometimes this is going to be labeled a little bit different, but for this particular insurance, they say it's finalized. The claim encounter has been completed. Has completed the adjudication cycle and no more action will be taken. So that means that a check is going to be released. I did one a couple weeks ago for United Healthcare with a client, and it actually showed us for United Healthcare, it gave us more information, told them exactly when they were going to receive the electronic funds transfer in their bank, which was pretty awesome information to have. But it shows you here the total claim charge they received, the claim amount that is the total claim amount that is paid, that you're going to receive as payment. It does not have a payment date in here yet, so that means it hasn't been paid just yet, but it's going to be paid $38. So you can see how much you're going to get paid before you actually get paid. It'll also tell you how they're going to pay you, whether it's electronic funds transfer, paper check in the mail, however you have it set up with them. And then here it's going to give you the date of that check. So that's how we knew when we did that United Healthcare one, it had said that Friday, because it had the date in here letting them know that's when they were going to get that payment. And then it also gives you the check number or the EFT trace number. It's a great information to have. It also breaks it down here by the procedure codes. You can see here the total payment amount for that top procedure code, and then the bottom one is here. And then it gives you the codes as well down below from the ERA that they processed. So good information to have, especially so you don't have to pick up the phone, call the insurance, go through all of those annoying prompts, press 1, press 3, and sit on the phone for 5 minutes just to press numbers, and then sit on hold again to get a rep on the phone to get this information, or speak into the phone and the automated system does not understand what you're saying, and you eventually start yelling at it. So huge time saver here as well. So that is the claim status service. And then we also have the patient responsibility estimator. So as you know, there's a new, Kevin, I forgot what that act is called that they just passed, where you need to provide, if it's going to be like a out-of-pocket cost you need to provide an estimate, and so that the patient is expecting, they know what to expect to pay. So they are not, that amount doesn't change, once you tell them they need a procedure and they come in the office and they know exactly how much they need to pay out of pocket ahead of time, and it's not going to be different at the time of service, or they're not going to get an EOB later saying, you owe $300 more than what we thought. You have the capability to run the patient responsibility estimator. So it's going to you're going to produce an estimate. Now there are settings you can do. So you can set up certain insurance payers for this to pull certain fee schedules, and also load your provider information so it populates. So what this does is it's going to generate that estimated a letter that you're going to provide to the patient. So I want to show you what that looks like. So if we come in here, you will have to click the new estimate button. So these are ones that I did previously, and I'll show you what it looks like. But you're going to fill in all this information. So I'm just going to show you one that's already done, because to save some time here on this call. But you can select the insurance payer, type in all the information for your patient. When you hit search, it's going to populate it and give you another screen where then you can then select the procedure code and the provider that it's for. And so when you're done doing that, it is going to generate this patient responsibility estimate letter that you can provide to the patient. You can customize this letter. So in the top left-hand corner, you can put your own logo up here. You can also customize what you want it to say here. In the middle here, there's also a link. If you allow payments on your website, you can put your website address here so they know where they can go in and make the payment to. If they want to pay it ahead of time, they have that information to go ahead and make that payment. And that definitely helps too for people that do want to get that taken care of right away. So it also has a signature line so that you know that the client or the patient is aware of this. You can make 2 copies, that they can sign one and you can hand them the other copy. So when you do generate this, it does save a copy in here as well. So if a patient calls back later and says, hey, I still need that letter, you can come back into this screen and you can see here, I have one that I just did this morning. And on the very last column, there's a copy of that letter. And that is that same letter. So you can always access that later if you need, if they call back a week later and say they need it again. So that's the patient estimator tool. So I hope you guys find that valuable. We believe it is, and we offer that. There's another feature I want to show you that is the EOB conversion, and this is one of the most awesome features I have seen as well. So what this is you can upload a paper EOB. You drag and drop it in this box. It has to be a PDF copy, which you can get most of those from your insurance company's portal. If you have like those smaller insurance, hopefully you're getting all of your EOBs electronically. That's the goal, is to get them all electronically. But for ones that those smaller insurances don't offer electronic EOBs, and you're still getting those on paper here and there, you can, again, get them from their portal, or if you get them on paper in the mail, scan them in as a PDF and then just drag and drop it right in this box. And when you hit submit, it is going to load it down here at the bottom. And I don't have like a live one. Well, this isn't like, the service isn't turned on this demo, but the status will update to say processed. And then the results here will update as well. And once that is updated, that shows that it's completed and processed, you're going to be able to see a copy of that, or electronic remit, that you can download into your revenue management and post electronically. So even with paper EOBs, with this service, you don't have to post those manually either. That's pretty awesome. So that service is there as well. And then let's see, the last feature I want to show you here is going to be it's called Revenue Resolve. And this one is really nice too for clients that are consistent with working their denied EOBs, any denials, any denied claims on your remits. What the Revenue Resolve is it allows you to manage your ERA claim denials in one central location. It grabs any claims that are denied on a remit that comes back in, and loads them here on the screen. And so if you have a billing department where you have one person that assigns things and other people that work on them, this is perfect for that. Or even if you're just doing it yourself and you're a single biller, same thing. This is the admin view of that. So if you are like the head biller or the billing manager or something, and you have other staff that help post things, you do have this is your dashboard where you can see what has come in. On the left-hand side, you can see the status of the remit. So there's 4 new ones here. I don't have any that are closed or being appealed right now. On the right-hand side, this is showing you the reason for denial. So these are all of the top reasons. You also have the capability of loading your own reasons in here. So if you find you're getting EOB and that reason isn't in here, in the settings here, you can add your own reason, and it will, if it matches on the remit, it will add that and load it here as well. So you can see how many are the service was billed and not separately payable. So if this is something you want to assign out to different staff to work, you can do that as well. At the bottom of the screen, all of your denied claims load. So if you're the one assigning these or just working them yourself, you would just come in here and work them. But if you want to assign them to another staff member, you would just click on it and it's going to load and give you all of the claim or the remit detail, the claim header information, the payer on the right-hand side, the remit information. You can even view the paper EOB here. If you click on the little glasses, it gives you a view of the paper EOB. And you can assign this to your staff. So if I wanted to assign this to someone else, I can hit change owner. I'm the only one in here, so it's not going to let me, but it gives you a list of different tasks. So it needs to be fixed, it needs a pill, build a secondary, build a patient. So there's lots of things you can do to assign it. And then it also gives you, so I'm going to assign this one, needs to be fixed. And then you can give it a status, would be new. You can give it a priority, low, high, normal, urgent, and give them a due date. So if I'm going to give them a couple days to do this and then hit save. If you're a staff member, you're going to go to the workspace. When you pull up the workspace, you can use these parameters up here, these filters up here to do a search to locate certain claims. Maybe you just want to look at things due that specific day. You can put the due date in there and hit search. But here's what loaded for me. So you can see this bottom one, I'm going to hit the little pencil. The pencil lets me edit it. So this is how, if I'm a staff member, I go pull it up and work it. I can add notes here on my screen. Notes go here. I can also attach documents if I need to do, use some supporting documents, or I have a denial letter or anything from the insurance company, anything related to the claim. You can load those documents here so you can keep track of them easily and not have to, go through a stack of stuff on your desk, file it, load them in here. Everything should be paperless. So if you can pull it from an email, drag and drop it from an email right in this box. So you see here I have an appeal letter attached. And then under history, you have the history. It keeps a log of the timestamp of every time somebody touched this claim and made any changes to it on the claim or the denial. It also has here display appeal letters. You can also generate an appeal letter from the portal as well. Again, huge time saver. Here's a list of the appeal letters. There's a timely filing letter. You have all these different type of appeal letters here. Here's a generic appeal letter where you can type in the information and populate it. I can change this if I want to put a different insurance company name in here. You can even choose and automate. You can load a signature in the settings. I don't have one set up, but you can choose a signature from one of the providers in here. And it populates all of that information here. And you can even change this is just generic, so it populates this by a template. You can come in and customize it as you see fit, and then hit save or generate appeal letter. And here's what it looks like. And again, you can load your logo on that too. So again, it's a huge time saver with everything. That is it. Oh, one last thing too. With the revenue resolve, this is important too, because I know with denials, we get this question asked, I do a lot, about, is there some sort of report where I can see how many denials I'm getting. I want to see if it's improved or if I've gotten worse over the years or the months. There's tons of reports throughout the portal too, not just for denials, but for claims as well. Lots of reports you can run here as well. Some clearinghouses don't have any reports at all that you can run. So this is nice. These reports are just for the denials. There's about 20 more reports you can run for claims. So there's one here, denials by procedure code. This one's really cool. You can group it by payer. And I'm just going to change the date and show you guys really quick a little example of that report. This is useful information. Once you have it, you can't go without it. So I'm going to view it. Another awesome thing with this clearinghouse, with our clearinghouse, is that you can schedule automated reports to come back to you by email. So if this is a report you like, you can schedule this to come to you once a month, once a week, however often you like. And it's like I said, several different reports you can do that with. So this is pretty awesome because it's going to show you, you can keep track of like which procedure codes you're getting the most denials for. And it also breaks it out by insurance. So this is for Medicare, and this G code I've gotten 3 denials for. And of course, this is all fake info. So probably doesn't make any sense, but it's just an example here to show you out of the 10 denials, which procedure codes those were and which insurance payers those came from. That's important information to know to see if there's a trend. If there's something that needs to be corrected and fixed in your Medisoft or, properly trained. So that concludes the features of the automated clearinghouse and the add-on tools that are going to help you save time everywhere throughout your billing. So let's go back to, all right.
Tasha, thank you.
You're welcome.
Of great information there. Hope you all learned something, gained some valuable information, and you'll be able to walk away with this with some good takeaways. So, okay, with that, let's go ahead and wrap up. It looks like we just have 3 questions there. And first one is from Lori. She asked, what does it cost? And I'll go ahead and take that, Natasha. So it's a great question. What does it cost? So again, please call your account rep. It runs, again, depending on whether we decide to do on a per transaction model or a per provider model, whichever is going to save you money. It really depends. A per provider model can be anywhere from $69 unlimited to $129, depending on how many providers and what tools you're going to use in there. On a per transaction model, it can run anywhere from 9 cents a claim all the way up to 22 cents a claim. So it just really depends. So the best thing I can tell you, give your account rep a call. We'll ask you a few quick questions, and then we'll be able to give you a quote and no strings attached there. So if we can help you and save you money and you want to take advantage, great. If not, great. At least give it a look. Next question I have is, what is the typical time frame to switch over to this clearinghouse? Okay, so again, another good question. So part of the reason we're giving you the 2 months free is so that you'll have ample time to get set up with Medisoft EDI, and not have to pay 2 clearinghouse bills at once. So the way it works is you'll fill out the enrollment forms, which are just 2 pages, pretty easy. That'll be submitted to us. We'll get you enrolled. That usually happens in 3 to 4 days. And then when we get the approval or the notification from the clearinghouse that you have been successfully enrolled, we will contact you and allow you to schedule a convenient date and time for you to do the onboarding. And we'll get those scheduled and get you sending at that time and get your carrier approvals done, which are all mostly electronic on the website and easy to do. We'll hold your hand. We'll take you through the process. We're good at it. We've done it hundreds of times, and we'll make sure that there's no loss of revenue or nothing lost in transition. Last question here is, can these things that have been that you've shown, Natasha, like a claim status inquiry, be done in Medisoft? So yeah, excited to talk about that. all these things that you've seen today are eventually going to be in Medisoft. Some of them are in there right now. Some of them are going to be built into Medisoft as the months go on in this year. Right now, the developers are in the process of integrating all of this into Medisoft more tightly right now. We just found out just yesterday, actually, Natasha and we were talking about right before this webinar started, that the claim status inquiry is something that should be able to be done in Medisoft now. And so we're going to be working on that over the next couple of days, but that's an example of something that, like right now is being implemented into Medisoft. So the patient estimator, you cannot do that from within your Medisoft pane of glass right now, but that will be something that will be coming, that is slated for either, I can't remember if it's Q3 or Q4 of this year, but it will be coming. All of these things will, because Medisoft and the Clearinghouse are the same company now. It's going to be very tightly integrated like that. Okay, one last question. Chris asks, how long does it take to set up payers with a clearinghouse? Natasha, can you take that one?
Yeah, so it really depends on your insurance payers. Medicare generally takes 1 to 2 weeks as far as claims go. There's only a handful of insurances that require enrollment to do an EDI, a re-enrollment when you do claims. It's not being credentialed again. That's completely separate. This is just telling them that you switched clearinghouse so they can open up the port to accept the claims. So there's just a handful. It's usually the government payers like Medicare. Some of the Blue Cross Blue Shields, it depends on the state you're in, require it. Some don't. Some of the Medicaids, again, depending on your state, some don't. Railroad Medicare, because it's a Medicare, and some of the TRICAREs. So for claims, it usually takes a couple, like 2 weeks for those enrollments, 1 to 2 weeks. For the ERAs to get transitioned over, or if you never were receiving ERAs and you want to start receiving ERAs, that can be 2 to 4 weeks for them to reroute those. They have to go in and update their system and do some things in the back end at the payer side to switch those over, to reroute them to a new clearinghouse. Sometimes that does take time for those payers to transition and reroute those ERAs. So for the first 2 to 4 weeks, you may still get those. If you're receiving ERAs from an existing clearinghouse, they'll still continue to go there until they're rerouted to our clearinghouse. So we just recommend, at least for the first minimal, the 30 days, you continue to keep your old clearinghouse up and running, or 2 months is even better in case you have any, backlog stuff you need to do. You can always resend your claims through our clearinghouse. You don't have to, work all your old claims through your old one. You can actually just go in Medisoft, change the receiver to the new receiver that we're going to configure for you, and rebuild a claim through the clearinghouse here. So you don't have to actually wait until all of your claims are corrected with your old clearinghouse.
Great, Tasha, thank you. Well, thank you, everyone. This will conclude the webinar today. We again appreciate your willingness to join with us today. And again, hope it was worth your time. Thank you. Take care.
Thank you, everyone.